My name is Abiola Adeniyi, and I'm currently the chair of the Oral Health Working Group at the World Federation of Public Health. I am by training a public health dentist, and I work as an assistant professor in global health and human services at Fairleigh Dickinson University, Vancouver, Canada. I started with a undergraduate dental training at the WFPHA University in Nigeria, after which I completed a residency in dental public health at the National Postgraduate Medical College of Nigeria. From there, I went on to do a master's in public health, first at the University of Leeds, and then I followed that with another master's in health management policy and planning at the University of Leeds in the UK. Most recently, I completed a PhD in population oral health research at the University of British Columbia in Canada. Over the years, my work has spanned clinical dentistry in teaching hospitals. I've worked on advising on oral health policy, and I've also taught in preventive dentistry and global health. What ties it all together is my passion for integrating oral health into broader health systems and for improving access to oral health through policy reform. That's the perspective I bring to my work at the Federation. As a child, I spent a lot of time in the dental chair. Both my grandmother and my mother ran confectionery stores in Nigeria. So you can imagine I had plenty of access to non-refined sugars. My mom did her best to encourage good oral hygiene, but like many children, I didn't always listen. And that meant I had frequent dental problems. I was in and out of the dental clinic as a child. Those early experiences taught me something important, that oral health isn't just about teeth, it's about overall well-being, because I had sleepless nights from dental pain. I also learned, sometimes in the hard way, how valuable prevention and good daily habits can be. And this prompted me to go into my career as a dentist. When I started my dental training, I saw just how common and preventable dental diseases were at population level. And that for me was the turning point. I realized I wanted to do more than treat diseases one patient at a time. I wanted to work more on prevention, on reaching more people, and on building fairer systems. So that's what drew me into dental public health. And even now, after my MPH and PhD, that original motivation has not changed. I want to create environments where oral health is accessible, prioritized, and prevented, not just treated after the problems occur. I have been part of the WFPHA for about 3 years now. I joined shortly after my PhD at UBC, and it's been an incredibly fulfilling journey. It's given me the chance to contribute to global advocacy, to research, and to collaborative action around oral health. And it's also given me a chance to connect with really inspiring colleagues from all over the world. To start with, right now, our group is involved in some really exciting work. First of all, we're partnering with the Non-Communicables Working Group of the WFPHA on a podcast series that is exploring the connections between oral health and various systemic conditions like diabetes, cardiovascular disease, and a number of other NCDs. It's a way of broadening the conversation and to show how oral health is an integral part of the public health picture. Secondly, we're putting some more focus on amplifying the voices of patients and communities. We believe that lived experiences is important for shaping policies and designing solutions that really work on the ground. So we're looking at how we can listen better, engage more meaningfully, and measure the impact of our engagement. Another thing we're exploring is how to strengthen the role of civil society in oral health advocacy. We're planning an event around the upcoming UN General Assembly, and we're looking at how can civil society organizations drive the agenda for oral health. As we know, civil society organizations are often closest to the communities they serve, and their insights and leadership are key to creating sustainable people-centered change. Some other areas we're exploring is digital health or digital oral health. We're thinking about how can technology improve access, education, and care delivery, especially in underserved areas. We're also exploring how we can learn from global models. We have a casebook on school oral health, and we're seeing how we can have a similar approach to how integration of oral health into general health systems is happening globally. We're looking for ways to identify how other countries have integrated oral health into general health systems and seeing how we can learn from these experiences and adapt them to other contexts or scale them for even greater impact. Most recently, we've been invited by the WHO to contribute to the Global Coalition on Oral Health, particularly within the workstream on meaningful engagement of people with oral diseases and other NCDs. We believe it's a great opportunity to bring together community systems, policy, and innovation. And we see it as an opportunity to make sure that oral health is not an afterthought, but it's considered alongside other NCDs. I'm looking forward to seeing how our group will be a catalyst and will connect sectors, elevating voices of the oral health community. Our work is closely aligned with the WFPHA's priorities on disease prevention, health promotion, and inclusive public health leadership. For example, over the past few years, we've developed policy resolutions, including during the COVID-19 pandemic. And we also launched a maternal and child oral health initiative that has been endorsed by more than 50 organizations, public health organizations globally. We've produced tools and surveys around workforce in oral health, school oral health programs, and we're looking at digital resource evaluation. More recently, we're working, providing feedback on the WHO Global Oral Health Strategy. All of these reflect the Federation's broader goals about strengthening health systems, elevating underrepresented voices, and fostering collaboration across sectors and across borders. Being part of the WFPHA has expanded our reach and credibility. Through the WFPHA network, we've collaborated with other working groups to drive meaningful interventions or initiatives. We've published in a number of high-impact journals and shared our work at international conferences and global policy forums. One good example is the Global Maternal and Child Oral Health Initiative. It was developed through partnerships across continents and with the WFPHA platform. We gained support from ministries of health, international NGOs, and academic institutions, something that would have been hard to achieve on our own. More recently, we worked on the school oral health case law, and that also had a similar leverage from public health associations, from academic institutions, and we've been able to share a lot of our work at many fora to advocate for oral health. In terms of how being part of the Federation has enhanced our group's ability to advocate for dental public health globally, I think the Federation gives us both the platform and the legitimacy to bring these conversations, right, where we would ordinarily not be able to have access, or into areas where it might otherwise be overlooked. We have been able to frame oral health as part of universal health coverage. We've been able to frame it as a social justice issue. And more recently, we're framing it as part of NCD prevention. So being part of the WHO Global Coalition on Oral Health, for example, came from this advocacy. And what being part of the WFPHA does for us is that it gives us a seat at the table where decisions that shape global health policy are made. To start with, our focus is really on advocacy and on policy in our working group. But we see a big gap in terms of global data on oral health and in terms of the stories of people who have lived with oral diseases. When I started, I shared my own personal story, but it's not well known what people experience with oral health. So one idea we're exploring is to systematically gather and share these voices through the WFPHA network. This might be through a short survey or a call for testimonies sent out via our member associations to collect experiences, barriers to care, or people's ideas for solutions. Then we can weave these insights into our policy briefs, advocacy campaigns, and global statements. With the WFPHA's reach, we can make sure these perspectives, often missing from high-level discussions, are heard both nationally and internationally. The WFPHA has opened doors for us, doors for collaboration, doors for knowledge exchange, doors for high-level engagement. For instance, we co-developed the school-based oral health casebook that featured 8 international models from the 6 global WHO domains, which is a first, for us to really see what is happening in different parts of the world. We've also collaborated on a global workforce survey, and based on that, we're able to publish policy relevant findings. What should we be doing in terms of global oral health workforce? I spoke earlier about the podcast series that we're working with that has been highlighting how oral health connects with other health systems. One thing we have done is we've had experts from different parts of the globe speaking about this connection and bringing their own experiences from their different zones of the world. I believe that this opportunity helps us make oral health visible, honestly, and makes it more relevant and brings it into spaces where it hasn't traditionally been prioritized. It helps us introduce it into conversation amongst policy decision makers, amongst those who matter. I think that's what we've been able to achieve. In terms of last comments, I just want to share about how grateful I am for the opportunity to be chair of this wonderful working group. I'm enjoying this opportunity because of the foundation laid by my predecessors, and I'm thankful for them. We have a dynamic, globally diverse team, and I believe we're entering a new chapter where oral health will become more recognized as essential to public health. I'd like to say that we're excited to collaborate with new partners, we welcome emerging voices, and our hope is that we will see a world where oral health is seen as a right and not a privilege.